Yes, I was born and raised in India. I went to dental school there, which is kind of the equivalent of doing an undergrad degree here. Fortunately, I got accepted into the University of Pennsylvania, which is an amazing institution, and I owe them a lot for the awesome education I've received there. Once I was done with that, I pursued an AEGD program through the Lutheran Medical Center. After that, I applied to ortho program, and I got accepted at A.T. Still University. And I'm an orthodontist now, and I've been working with Western for 5 years. They gave me a wonderful opportunity to actually run and manage a clinic on my own, which is rare for a new grad, and finding opportunities in this highly competitive market. So Western were the ones who kind of got me in, trained me, gave me the opportunity to work full-time, and all the resources were provided. I used to live like 70 miles away. They put me up in the best of hotels. All the booking and everything was taken care of. All I had to do was go to work and learn the whole process, and all the assistants are so well trained. Most of them have the OA permits, which is the orthodontic assistant permit. So actually I learned a lot from those wonderful assistants who've been with the company for a really long time. So basically you have your whole infrastructure, so it gives you good work-life balance. All I had to do is go home and relax. I don't have to worry about billing. I don't have to worry about any administrative work. As you're an orthodontist, you tend to see more patients than your typical GP, but then you have a full staff supporting you, and it doesn't seem so difficult. We have a good structure of how the book is, and as doctors, we have a lot of control over how we can schedule our appointments. You have complete control over your cases. Nobody's ever going to interfere clinically with your clinical decisions. Not once has anyone in my 5 years told me, no, this should be treated this way, or the length of the treatment should be this way. You have complete control. You're the leader here, so it gives you a leadership opportunity. If you want to start your own practice, this would be the best training ground, if I would say. And then the compensation is amazing, plus great work-life balance. That's what everybody wants at the end of the day. So you're not taking the stress of running a practice home. I have a lot of flexibility with my days, and that gives me a lot of time for my children, my twin toddlers. And even before that, when I was expecting and pregnant with the twins, the day I said I couldn't work anymore, they found someone to cover for me. So that's the biggest thing. If you're sick, if you need coverage, there are always doctors who in the network who would come cover for you. And so that's never a stressful thing, versus if you're running your own practice, to find somebody to cover you can always be so difficult. I could take the maternity time I wanted, and when I was ready, I was back to my offices. I think this would be the best for work-life balance, especially for young mothers. I would highly recommend Western Dental.